Let's talk about a type of hearing loss that most people actually aren't aware of. This is a hidden hearing loss, also known as auditory processing disorder or central auditory processing disorder. The simplest definition of central auditory processing disorder, or CAPD, as one would abbreviate it, is that the peripheral hearing, or our hearing organ, and our middle ear bones and every part of our anatomy for hearing is perfectly healthy, testing within normal limits as far as a hearing test goes. But yet, this person still complains about not being able to hear a noise, not being able to follow verbal direction, having a hard time in a classroom setting or in a large group setting. And they get told over and over again that their hearing is normal. There are tests for CAPD. What happens is that there is some part of our auditory development that gets a little bit funny, where even though we're getting all of the information that we're supposed to get, it takes longer to download it or make sense of it. A lot of the time, it is associated with other learning disorders, attention disorders, sometimes kids that have had frequent ear infections, especially at the beginning of their life when language development happens. And so what we see is that they need this extra time. They're not being given the extra time. And they, a lot of the time, are looked at as people who misbehave in class. Sometimes it leads to social anxiety because we don't do well in groups, depression, social isolation, because we try to keep ourselves out of the situations where we know we don't hear well. If you know anybody or you yourself is experiencing difficulty in noise or difficulty with verbal directions, had trouble hearing, even though you've been told you have a normal level of hearing in your ear or hearing test, it's a good idea to go ahead and get that evaluation done. There's a lot of therapies that can be given to improve the skills that your brain needs in order to do well in those environments. The outcome is really promising.